today, the growth of non-traditional students attending universities has increased significantly. According to the university system of the Board of Regents, the definition of a non-traditional student is a person who's been out of high school for at least 5 years. In many areas, there are healthcare professional shortages, which have encouraged students to pursue a degree in the healthcare field. One demanding career in healthcare is registered nursing. Registered nursing programs prepare graduates with the skills necessary to be competent professional individuals who engage with patients hands-on in a healthcare setting. Acceptance to most nursing programs is highly competitive and dependent on a ranking system that considers the GPA of the number of prerequisite courses completed and the score of the pre-nursing entrance test. Scores alone should not be the deciding factor when considering the acceptance of an applicant into a nursing program. We all know that for many, the first time venturing into the waters of college straight out of high school can result in not putting their best effort forward. According to statistics, the top 3 reasons of college dropouts is because of lack of finances, failing grades, and outside jobs. Countless non-traditional students fall into one of these categories, in which they initially attended a post-secondary educational institution and had to leave prematurely. Many non-traditional students who had to drop out of college due to failing grades often return back to school with the mental maturity needed to be successful in college the second time around. Because of this, more nursing programs should start using a more holistic approach when considering acceptance into the nursing program. A holistic approach focuses on leadership qualities and prior life experiences rather than solely on GPA and entrance exam scores. Using a more holistic approach for acceptance into a nursing program not only benefits many different types of students, but can benefit the entire community. There are non-traditional students who initially obtain unsatisfactory grades who can benefit from the help of the holistic acceptance approach, giving them a second chance to pursue a lifelong dream to help others. There are traditional students who have completed the required prerequisite and co-requisite classes as well as taken the nursing's entrance exam. However, they may have fallen short of the minimum acceptance requirements, yet they still have a history of passion of caring for others through volunteering and work experience that will make them a perfect candidate for the nursing program. Another reason that GPA and entrance scores should not be a deciding acceptance factor is because many people who would turn out to be excellent nurses may not test well. On the contrary, there are occasions where those who test well enough to be accepted into a nursing program may not have the passion, dedication, or moral competence to be an excellent healthcare professional. With the help of the holistic approach, schools will be able to provide the community with better quality nurses because they focus on the character and the passions of a person rather than just test scores. Schools can start accepting more nursing students if they focus on in-depth qualities of an individual that are used in the holistic approach. The higher number of people being accepted with the help of the holistic approach will result in a higher number of quality professionals available to satisfy the nursing shortages in our community. Accepting students based on a holistic approach also benefits patients, the families of patients, and the economy. Although most nurses are dedicated, far too often we read headlines, watch breaking news, or hear first-hand experiences of disturbing stories about patients being abused by nurses. You may have even heard a story or two of nurses abusing drugs that they have access to at work. Although there is no way to predict the future conduct of an individual, taking a holistic approach when considering acceptance can drastically reduce the amount of misconduct of nurses in the work field. Many patients and their family members already have a level of confidence in nurses that tend to them. With the holistic acceptance approach, they will be able to have an even higher level of confidence, knowing that they are in the best hands that healthcare can provide. The economy could benefit from the holistic approach that post-secondary registered nursing programs should take. As mentioned before, with the higher acceptance of more quality students that the approach would give, there would be a larger number of registered nurses. The salary of registered nurses is satisfactory and will not only benefit those who are able to become registered nurses directly, but with a higher amount of disposable income, the economy will benefit from their purchases. It is time for nursing programs to take a different approach when it comes to accepting students. Whether due to personal past downfalls, or low testing scores. Many people with the dedication to be a good nurse may need the second chance that the holistic approach could give them. The holistic acceptance approach will positively affect everyone that is involved in the healthcare field and should be seriously considered in order to increase our quality of care.